أول ما بتلتقوا بحدا بتسألوه شو الأخبار، لهيك لنكون قراب منكن ونحكي لغتكن سمينا حالنا شو الأخبار. بلشنا بخطوة وماشيين بآلاف الأميال، خلينا شغفنا الخبر والعين اللي بنشوف فيها هالدنيا عدسة كاميرتنا. قررنا نكون منكن وإلكن، تشاركنا فرحكن وحزنكن، تشاركنا مشاكلكن ووجعكن، وكنا ورح نضل منبر لجاليتنا. شو الأخبار ويب تي في باءة كبيرة ومتنوعة، برامج حوارية، تقارير إخبارية، برامج ترفيه، برامج ثقافية، بالإضافة إلى إعلاناتكن. شو الأخبار؟ الخبر اليقين. تابعونا الآن.
Good evening, everybody. Welcome to a special episode of the Community Corner. Today we are honored and privileged to have such talented and great guests to tackle such an important topic that our community has been suffering for a long, long time, and it has been considered like a taboo to talk about. So today I'm really honored, your host, Khodr Farhat, to lead this discussion alongside my co-host, Hussein, who will be jumping in from time to time, and he might not do that, just giving us a heads up. I'm honored to have Dr. Abdulhassan Saad. Hello, Salafik. Thank you for joining.
Thank you for having me.
We have George Lee.
Long.
George Long. I apologize. The third, Dr. Saad's office director. Welcome. Thank you for being here.
Thanks for having me.
As well, thank you. As well as we have Dr.Shady Shebak. Thank you for coming here as well. Thank you for your time. Before we get started, we'd like to highlight and to thank every single WhatsApp Media Network sponsor, and thank you for WhatsApp Media Network, obviously, for paving the way for us to highlight such a very important topic. So welcome everybody again to the special episode of Community Corner. Addiction and mental health is our topic today. We're gonna start from, I'm not sure who wanna go first, but the question is, where are we from the entire discussion? First of all, how can we define, the correlation between mental health and addiction, if there is any?
Well, so I can start, Shady. So addiction is a brain disorder. It's a chronic brain disorder that's relapsing and remitting. And patients who suffer from addiction, the majority of them have a co-occurring mental disorder, whether it's anxiety, depression, or other mental disorders. And addiction itself also falls under the blanket of a mental disorder as well. So they're intertwined.
Any addition, Dr. Shady or George? I mean, these are open-ended questions, of course, just to enrich the discussion. And then, of course, I don't want to forget to mention that we have also a great panel as well that we're more than happy to hear their comments and their opinions as well. And then, of course, followers and our audience, make sure that you share the video, make comments, ask any question. We're going to make sure that, the questions are asked to our experts. Sorry, Dr. Shady. So
I think the correlation is sometimes it's a little not so obvious and sometimes very obvious. So someone has anxiety. Oftentimes they may want to self-medicate, or they may get some prescriptions that are addicting and then end up on it long term. So then they get an addiction from that. It could be direct in that way, or it could be indirect, like I said, self-medicating or drinking casually, and then that gets worse and worse and worse. Or someone has a physical disorder that leads to dependency on substances. So let's say someone has a lot of depression, right? You're depressed and there's no access to care, so you're going to take it out on something else, right? You're going to channel that depression into using, not everybody does that, but that is one way that an addiction could be tied in with mental health and mental illness.
Cool. So if also before we can go any deeper, just I want to see if you guys can provide us, like your insight about your day-to-day activity at your clinics. I do understand that both of you guys are really great at addiction and mental health. So I'd like to ask that question at first just to introduce the topic and to make sure that the audience understand that there's a correlation and they are both considered mental illness-related issues. What would be the most common case that you guys get?
I think before going into that, I just want to also explain a little bit about what I do. So as a psychiatrist, what I do is I manage people's mental illness with medications and some therapy. So I diagnose and treat mental illness. The reason I chose this field is because I think that I felt there was a need in our community, in the Arab American community, and in the country in general. There's a need for mental health care and psychiatry. These people are often forgotten or put to the side or laid to waste, or they're kind of
Or
like
it's a taboo to talk about. Meaning
a taboo,
something shame.
it's a taboo in just about most communities. You know, often we pick on our community, like Arabs have this taboo on mental health, and Arabs are, you know, we need to talk more about it and this and that, but really it's not more of a taboo in the Arab American community than it is in the white American community, in the Black American community, in the Hispanic American community. It's a taboo all around. So that's one thing I wanted to explain, that we're not behind any other community. We're doing what we can, and we're doing the best we can, and we need to speak about mental health, just like they also need to speak about mental health in their communities, and you know, that kind of thing. That's very important, I think, because sometimes when we put too much guilt on a community and their culture, and instead of helping a community acculturate and integrate into a new society, right, into a host country, we come. Our parents and some of us come from different countries, different culture, and we're trying to integrate into this country and into this culture. And instead of helping, when we're hypercritical of a culture and a community, what ends up happening is that integration ends up not doing very well. And I'm going to touch up more on that in a little bit. Yeah.
Sure.
So my day-to-day is, I see patients, I do intakes. I work very closely with Dr. Saad. We have a lot of joint patients that we see together. So we refer back and forth, and that's kind of in a nutshell what I do, and I'll let him, him and George kind of explain what they do and what their day looks like, and I'll add a little bit.
Exactly. Dr. Saad, that question also, of course, touch on like your specialty as well, and then we're going to talk about.
So my background was actually in internal medicine, primary care. I graduated residency in internal medicine and took a hospitalist job with the ultimate goal of opening a primary care office in our community. While I was a hospitalist in Ann Arbor, there was a role for a hospitalist addiction doctor, so somebody who would admit patients for primary hospital medicine that the patient suffered from addictions. And that grew my interest in addiction medicine as we have the opioid epidemic and alcohol epidemic that have been hitting our country. I've seen more and more admissions and was intrigued more, so I went back and completed some more training, took some more board exams, and was double boarded in internal medicine and addiction medicine.
Awesome.
Yeah, so then thank you so much. So we actually opened our office in Dearborn, and it still is a primary care office, but we have a board certification in addiction medicine, and that's where I teamed up with George, where we started an addiction medicine outpatient service here in Dearborn and Sterling Heights.
Great. Yes, sir, George.
All right. My background is I manage medical programs, and part of that is understanding and supporting medication-assisted treatment. So when I was originally managing medical programs, they were internal medicine, just like how Dr. Saad started. But when you see the need, you see those patients coming in that have medication-assisted treatment needs, those diagnoses are rampant, and those folks, need a lot of attention. And I started working closely with the physicians, mostly up in Oakland County, and as they were treating patients, we saw a tremendous improvement. And when they would have a response that was very positive to medication, and they would come back for their follow-up visits and be smiling and feeling great, and their lives were improving, that became very rewarding. And so the more I engaged in that, the more I learned through the years, and was able to really, that became my specialty of how to manage administratively and support, making sure that providers had access, patients had access, and we would tear down barriers to access for patients through removing insurance requirements or financial burdens, so that when a patient was calling and saying, hey, I need to get in and see the doctor, they wouldn't get a response like, well, I'm going to have to put you in for an appointment 2 weeks from now on Monday at 3 o'clock. That's my only opening. Instead, I trained our staff to be, what time can you get here? The soonest you can get here. Today? Can you make it today? Can you make it tomorrow? As soon as you can get here. Because if somebody's calling asking for help, it's a very short window to help them.
Exactly.
So we're going to make sure they have access.
That's so awesome. So from what I understand, is basically Dr. Saad, you joined with Dr. Shebak from addiction for the most part.
So the way our practices started working together was, we would be taking care of primary care patients or addiction patients here in Dearborn, and these patients would suffer from a mental disorder, whether it's anxiety, depression, or other diseases, and it's very difficult to get a good psychiatrist, somebody who would see the patient, as George was saying, sooner than later, and provide good follow-up. And so me and Shady, we had a few discussions, and we started referring patients to him, and our relationship has grown, and we've been taking care of patients together and providing, well-rounded care.
Awesome. I mean, of course, we wish you nothing but the best, both of you. So basically, your daily patients are patients who are mentally, have mental disorders. In the meantime, they suffer from addiction.
For me, the majority of my patients are actually normal primary care patients, who might suffer from addiction or might not. So, the majority of my practice, actually, patients do not suffer from addiction. But we do have a subset of patients that do suffer from addiction we take care of.
Okay, sure. Before we continue on, do we have, we'd like to hear from our panel to see their opinion on the correlation between addiction and mental health, or anything that they have to add or make comment on.
So I was wondering about the addiction epidemic that's making waves across the nation. Since we are a close-knit community here in Dearborn, and we're a subset of the nation, is addiction, are we affected by addiction the same as the rest of the nation, or are we more affected, or are we less? Like, do you guys have any numbers? Or
so, if you just look at the statistics by the CDC, this is a more epidemic that's hit the whole United States. Not just Dearborn or our community harder than others. Pretty much, there is some cities that are hit harder than others, but anywhere you go or anybody you talk to, when it comes to specifically the opioid epidemic, they're going to know somebody or have a family member or a friend who is affected by it. So, what's happening here in Dearborn is also happening in Ann Arbor, it's happening in Royal Oak, it's happening all across the United States.
What I'd like to add is there's extra stress on an ethnic community or an ethnic enclave or an immigrant-based community, and that's the acculturation. So let me just explain that real quick, because I think that's really important. The Arab culture in general in North Africa, they come from this system of honor and shame, right? So it's an honor and shame system. What's honor and shame? Honor and shame is stuff that you basically you're standing in a community or in a society is based on other people's view of you, and that works in the Middle East. That's the way the culture is. There's nothing wrong with that. It's not a bad culture. There's no such thing as a bad or good culture. The West is based on a dignity model. So dignity model is very individualistic. Your sense of worth comes from within. So do you, be you. You hear these kind of things. Don't worry what people say. Don't worry about what people think. So we come from one place. We're going to another place, and these two are merging. Right, our culture is merging with the host culture, which would be in the West. That's a very stressful process, because in that process you can either integrate healthily, assimilate, so forget your parental culture and just assimilate, get marginalized, or separate entirely and go into your own little ethnic enclave and not even deal with the outside society. This process of acculturation is extremely stressful. It's not meant to be easy. And there's nothing you can really do. What you can do to make it easy is that we support one another in this process. But you can see that's an added stressor. And added stressors can lead to anxiety and depression and things like that. So there's added stressors. As for statistics specifically about is it more here or less here, I wouldn't know. I would have to agree with Dr. Saad on that. But we do have that extra stressor that doesn't exist, for example, in Birmingham or Royal Oak and places like that.
So can I add a quick follow-up? Because our immigration patterns to Dearborn here, like they span from more than a century to maybe even yesterday, people coming off the plane. And this problem seems to be hitting everybody, whether they've been here for decades or a month. So the question is, does our community need different resources from the rest of the United States to treat the addiction epidemic that's going on, or the resources that are available to the average American are sufficient for our community?
I would say that in any community you want something that's culturally appropriate and sensitive. So that would be something different, right? And in a faith-based community, I think our mosques and centers like that should be well informed on mental health and not just addiction, but mental health in general, and be able to provide proper referrals. Because the communities that are immigrant or newer communities, right, not brand new, we've been here for a long time, but they are faith-based often. And so culturally appropriate and faith-based initiatives are very important in such communities.
All right, sure. So my question is, follow-up, thank you for the question from the panel. So having said that, the problem is everywhere, every single culture, every ethnicity, group, and this and that, and we have the same resources, but the question is, from your practice, Dr. Saad and Dr. Shebak, do you see that patients are coming in from our community as much as the different cultures? Meaning, we do have this clinic, it does offer all its resources for treatments and this and that, but how are we compared to the other parts of the community, the United States society, the social fabric? How are we more receptive, to come and say, hey, I have an issue and I have to be treated, or I like to be treated, I need some help here?
So, I could talk specifically about the addiction part of it. So in our practice, I can't really give you statistics comparing, how often.
Just like an idea.
But an idea is we do get people from our community who will come in, and the unique thing about our practice is it's primary care. They'll come in, for primary care, but they'd be hiding their addiction. And then once they get comfortable with me, or once they're seen a few times, they'll open up and say, well, I'm actually, I looked up your qualifications. I seen you can help with, this type of addiction, and that's why I'm here. So we do have, especially I've been open for 3 years, a unique rise over the last year especially, where people are more open and they're seeking help. They're coming in, they're admitting there's a problem, and that could be linked with, a lot of the deaths we've had in our community. People are seeking help, they're being more open about it. We have a lot of, new groups in the area that are helping people out and accept that there is a problem, and we're starting to see that in our practice. So we are, in our community itself, starting to seek the proper help and accepting it.
From a mental health perspective, I'm seeing my practice about 35 to 40% Arab, and then the rest are, just the other nationalities, mostly Caucasian, and then some African Americans and Hispanics. What I've realized is if you create a safe space, a private place, where people feel like their secrets will stay safe with you, they will come. So, and I've done a lot of work in the past with Move. We have a nonprofit that we do a lot of mental health education. We do a lot of things to fight the stigma and things like that. But one of the most significant things that we've done is actually open up this clinic, the core psych, because when the patients come in, the Hajjs come in and they see the other Hajjs that they know from the community, they feel a sense of relief, believe it or not, because they know that they're all in this together. So that's one of the best things we've done to tackle the stigmas, actually to provide the service, to provide the clinic, to provide the safe place for people to come and feel like their secrets are being kept, right?
Sure.
And we've seen that several times because we have people from this community that know each other, and they come to the clinic and they run into each other, and it's so pretty, it's so beautiful to see actually, because they're not shy. They're, I know, I'm here, inti hanti man, you're here as well. It's very nice.
Oh yeah,
I think,
understand. Sure. Sure.
Do you have anything to add to?
Yeah, absolutely. We train our folks that are receiving patients in, all the front staffs and all the clinics, because Dr. Saad has 2 clinics, one here, and we've opened another one in Sterling Heights for Macomb County. I've run clinics in Oakland County, and one of the things we make sure is that the entire staff, not just that provider who's definitely enthusiastic and empathetic for the patients, but the entire staff is enthusiastic to help those folks. And as they come in, they're greeted warmly as they come in, whether they're for primary care or whether they're addiction patients. Everybody's treated the same. They're not second-class citizens. And over time, when those patients improve and do great, I'm able to distill their experiences through their remarks. They'll say, you treated me like a regular person, not somebody who was mentally challenged as far as being addicted, like I was something different. We're trying to treat dependency with medication so that they can have a chance to work on their addiction with a mental health professional.
Sure, awesome. Before I move on to my panel, if they have any comment or a question or opinion to voice, I would love to urge all our audience, if they have any issues or concern, whether regarding mental health or any physical disability as well, or even addiction, nothing is too late. I mean, coming sometime later better than at all, and then so we can save our life and a lot of pain, a lot of processes. Our panel, any question or concern or have anything to voice?
I have a question here.
Please, go ahead.
So in the last few years, we've seen an uprise in statistics in regards to addiction, mental health disorders. Part of it is a social media aspect of encouraging people to speak about their problems and their disorders. But there's also been kind of a new evolution in people's stances about life in general, especially in the West. And that's led to more disorders, more anxiety, more depression, more addiction. And what do you guys think, from your professional opinions, is the reason that we are leading into this new kind of realm of thinking and believing?
I think it's hard to, if I knew the answer to why suicide rates are going up, I'd be really famous. And I'm not, so. But I think there's some shifts. I would hypothesize that there was a study done to ask people with mental illness what are they missing, and they all, they said family, God, religion, friends, and then they asked mental health professionals what are people with mental health missing. More government funding, more government services, and it's like there's such a detachment. They're telling you what the problem is, right? So you ask a mentally ill person, someone with mental illness, what's some of the stressors? Now we know that there's many causes, biopsychosocial, spiritual causes to mental health issues. But you ask them, they'll tell you what some of the things that are missing in their life that could make the recovery easier or better. That's not to say mental health happens because of just because of family or faith and things like that. But they're telling you that this is the things we're missing. These are the things that could provide support for us to get better. So sometimes we just have to listen, I think. And research is extremely important in quantifying it. But in the meantime, I think you just listen to them and they'll tell you what they're missing. And that's one of the reasons we incorporate a lot of group therapy and group things in our practice at Core Psych. And
Cool.
And similar to what George was saying, people come in. I'm trying to provide quality service to an underserved community, and quality service that meaning we provide them with coffee, with tea, with meditation music, with incense. I'm trying to provide what the upper class get, but for an underserved community, because they deserve better.
Sure, absolutely, no doubt about that. Any addition, Dr. Saad, before I ask my follow-up question from the panel?
No, I think Shady did a good job with that.
All right, awesome. How about you?
Well, I think as far as the underserved community goes, you guys are doing a great job of making sure that you go out, you get trained, you come back to where you came from. You didn't go and open a practice in Birmingham thinking there's money there. Those communities have their own hang-ups. I have met and talked with plenty of patients that are from the more affluent areas, and their shame level is to the moon. And I've managed programs in hospital departments in Pontiac, very socioeconomically strata disadvantaged. Their access is very low. So tearing down barriers to access for them and welcoming them in gives them at least an opportunity, just like you said, to get into a place where you feel safe and get some sort of treatment, because they feel like they're disaffected because they have no opportunities outside of the daily hustle to make ends meet. So they have just a different mental challenge, and so that comorbidity of depression or anxiety is there no matter where they're from.
What's so important, I think, is to have private practices opening in these places with doctors that know a lot of what they're doing, not just sort of know what they're doing. And also you can't just rely.
And also to be culturally sensitive as well.
Culturally sensitive, and also to not just funnel these people through community mental health. I'm not saying I worked in community mental health. It's amazing what they do, but the patients feel like almost like it's a machine,
Correct,
right? But you provide them a private practice that's funded through private contracts with insurances, including Medicaid. and they feel more human. They feel more individual. They feel like they're not just being thrown through a system.
And then they build a relationship with you. They know they're going to come see this, the same doctor. They're going to be able to talk to, one of us each time they come in. We know their story.
Secure.
They don't need to repeat their story and go through all their problems again. And you build a relationship and are able to better treat them.
Sure. So my question was based upon the panel question by the panel is, I hear so many stories or incidents about both mental health and addiction that they are not visible. So how do you guys educate the parents or the society in general about the symptoms, or how can we say that this gentleman or this lady or this person in general that they are mentally disordered or they're addicted?
So the idea that they're not things that are certain mental illnesses are pretty visible. Schizophrenia, you could tell it. I could tell it from a mile away. But certain mental illnesses like depression or anxiety or OCD are not. From personal experience, I went into psychiatry. I was 16 in high school. We were in a psychology class, and we were watching this movie called As Good as It Gets with Jack Nicholson, and he has like the severe OCD where he locks and keeps checking the locks and keeps checking and washing his hands and throws away the soap and just all these rituals. And I remember watching that and saying, I do that. I thought that was, everyone did that, literally. So I had no idea that was something that could be treated because I struggled with that. So before I'd sleep, I used to make sure the blanket was on the same level at both sides of the bed. I checked my alarm 18 times. I put my chin on the wall for 18 seconds. I'd tap my knees together for 18 times. And then I'd go for, I'd count by 16s. Right? So I thought it's torture.
The norm.
But I had no idea. I thought everyone had these things, right? So from that point on, that's when I made my decision to go into psychiatry. I remember I went home and I told my parents I knew what I wanted to do. I wanted to go into psychiatry because I had no idea these were things that could be treated, and they are treatable.
I need an appointment with you.
The reason, so at 16, and you can ask some of my college friends, they'll tell you I'm one of the few that they asked, what do you want to do? And I didn't say doctor, I said psychiatrist. The reason I bring that up is because that wasn't visible until we discussed it. Right? And we don't have to discuss it like, oh my God, you guys shame mental health, this community's backwards. That's not the way to discuss it. You discuss it through education, through psychoeducation, bringing people to the clinic, bringing people to the centers, talking when you're given the chance to speak and educate people, because then you make it visible, people will recognize it about themselves, and then they'll seek the help, hopefully. If they don't, then there's other interventions at that point. And the other reason I brought this up is because I took medications for this, and my symptoms improved by about 70%. Right, and I'm not taking any meds right now, and I'm very private about my health. This is probably the first time I'm ever saying this publicly. My wife's probably like, "Why are you saying this? You don't like to be so public about things." But it's important because I took medications, symptoms went down 70%, right? And so I stopped twitching. I stopped the symmetry thing. So it is treatable.
Sure.
Right.
I mean, I'm going to come back to that point, especially that a lot of people also that they say, oh, you go to a psychologist or a psychiatrist mean there's something wrong with your mental abilities, so that's also another stigma or myth, if I can call it. But what about you, Dr. Saad, before we move on to the panel?
I'll speak about addictions.
Sure.
If you're a parent, you start to, you might have a teenager or a child growing up, going to high school, and their behaviors might change. Money might be a big issue. They might be getting into more trouble. You might find paraphernalia with them. These are just alarming features that you might look for in terms of seeing is your child using any type of drugs. Also, who they hang out with, their grades. A parent will know if they're a parent with a good relationship with their kid, if their child is changing for the worse. And sometimes, I'll have patients who come in with their mother, and the mother will say that this isn't my son or this isn't my daughter, something's going on. And it's not until that child's in my office where we have, the teenager, we have a one-on-one talk where he'll admit, I'm smoking marijuana, I'm using it, my friends are bringing it to me, and it's affecting their grades and how they're sleeping and going out with getting into trouble. So that's what I'll tell the parent, is to start to look for warning signs at a young age. Don't wait till they're past marijuana and using other drugs.
We're going to come to that. That's very important. Do you have any addition before we move on to the
absolutely. Shady made great great comments that allows, I applaud you because talking about it or having it out there that, hey, this is okay, and people can be more receptive to getting treatment. If a mom brings their kid in and they've had an open relationship and they've had the ability to have good dialogue that's calm and helpful, then that child or that, whether that child is a 24-year-old child of a 50-year-old person and is having challenges, rather than mom dragging the kid in by the ear, say, you are going to get straightened out and you're going to go to the doctor, or you better stop this. The same thing goes for being afraid. If somebody's not ready to change is not going to happen. So you have to feel comfortable going to see a professional, no matter who's sitting here. They have to be willing to change and open to that, and grasping with both hands the opportunity to improve. Then those folks have the best. Those have the best outcome. The people who are made to go there to get treatment out of coercion, say from a spouse, you don't get to come home until you go see that doctor and get clean. Well, then he's made, under duress to go do that. And so he's not going to be as successful. So we have to have really calm, supportive conversations at home rather than that kind of forceful clean up or else.
Sure.
Because it just never helps.
Sure. Before we take some Facebook comments and questions, I'd like to move back to the panel. Do they have any question or concern or opinion or anything?
Can I add a quick question? Since we have professionals sitting, and,
Please.
You guys all touched upon this briefly, and even it's related to a question regarding social media. And so we're seeing an influx of in our community with addiction, with drug usage, with mental issues, and usually when tragedy strikes and there's a suicide in the community, and everybody goes to Facebook and everybody becomes a professional on that day, and they start shaming the families for staying quiet. They don't want to talk about their recently deceased son or child, and many in the community start bullying them and you should talk about it. We have an issue. We have a taboo and whatnot, and et cetera, et cetera. So, as professionals, do you guys think people should become heroes or make their family the poster child for the issue, or do they have a responsibility to do so, or is it just a personal choice, or how should it be approached?
So it seems like someone gave you a list of all my pet peeves. Absolutely not.
It's an important question, by the way. Yeah.
But absolutely not. I think that's common decency, is to allow families to grieve and to be as they please, to do as they please with the tragedies that befall them. If a tragedy befell my family, I'm not sure I would want to become the poster child for that thing. I just want to grieve to myself and with my family and with my loved ones. That's my personal opinion. Now, there's great stories out there of families that take on the initiative. They sublimate. Sublimation is a defense mechanism. They take something bad and they kind of turn it into a cause or something like that. That's, good for them. That's great. But it is not our job to tell families what they should or should not do after they grieve. And I really, really find that extremely, extremely upsetting. And I think I've written several times about it on social media, telling people to cut that out, because that is not appropriate. It's common decency to allow people to grieve. And some families will want to be the poster child, and that's wonderful, and some families do not. And it is not up for us to choose. What it is for us to do is to promote activism or not even that word, awareness, advocacy, advocate, and send people to the proper avenues and to have a referral service and things like that. That's what our job is. It's not to become, Sherlock Holmes and try to discover why someone passed away or why families are hiding something. That's inappropriate. It's very inappropriate.
Everybody has the right to grieve, and however they choose to grieve, we need to respect that. As Shady said, we are not to judge, and we shouldn't be bullying people or forcing people to, reveal details that they might not feel comfortable revealing. In agreement, agree with your opinion, yeah.
Trying to place blame retroactively is silly.
Yeah, and even this whole thing of blaming the parents, this and that, you don't know houses
What
are
happened,
secrets,
yeah.
right? Buyut asrar. We don't know
Absolutely,
what's going on, so let's not do that. It just don't. I look at my kids every day and I try to give them the best life I can, but you you don't know what's going to happen in the future, who they fall in with. All this talk about, for example,
Friends
just a quick thing
associated
is
with, yeah.
marijuana. A lot of people talk about it being benign, right? And then
Sure.
a kid falls into it, develops psychosis, and then
yeah.
develops more addiction, and then, well, that wasn't the parents' fault. That's society's fault.
We'll talk about that more. Anything else from the panel before we move on to Facebook and social media comments? Any questions?
I have one question here.
Please go ahead.
And this is both to Dr. Oh, sorry. And this is to Dr. Saad and Dr. Shebak. So when parents bring in their kids, a lot of times we hear, I want this fixed. I want them to go back to normal. And because it's so intricate and has so many factors involved that it's not a quick fix, it's not a broken leg that needs to be mended. What can we say to parents to kind of satisfy the expectation for their kid to get better, and to have them help us, because it's a process between the child, the parent, and the doctor to work as a team. So what can we say to the parents?
You know, I always will tell a parent, I applaud you for bringing your child here, seeking help, because it's a big step to admit, you know, my child has a problem, and I'm going to go to a professional and get help. Some parents will feel they can handle it, or their children don't have a problem. So I'll tell the parent, you know, just bringing them here is a big step, but we have, you know, a road ahead that we're going to do it together. You know, we will refer you to the right avenue of treatment, whether it's just in our office, medication-assisted treatment, if you need to see a therapist, a counselor, and we explain that this, you know, we can definitely overcome the addiction, but it is a disorder that's going to need close follow-up, and you could relapse, or you could have problems down the line that we're going to always.
It's a process.
You know, correct, and we work with the parents to try to keep them on the path and not get discouraged if we have a relapse or an issue down the line.
So you don't like set high hopes, nor make it sound like it's not treatable either. So
no, it is treatable. You know?
That's what I'm saying.
We
So
just
you're not going
explain
to
to
set
them it's a
high
process.
hopes from the get-go, and then in the meantime you won't say.
Yeah, I've never told a patient
Exactly.
from the first visit, oh,
Exactly.
you have
So
nothing
you
to worry about, you're fine. Just
It's a process that
correct.
takes time. Dr. Shebak, any addition?
I agree, and I think it's important to tell them that, with regards to addiction, like Dr. Saad was saying, it can relapse and it's chronic, and that this is not like there's no miracle. And in mental health too, with depression or anxiety, these are relapsing things. So
Yeah.
someone will feel better. You know, you get someone with like a brief psychotic episode, they'll feel better, they'll put away their meds, and it's like they're surprised when it comes back because they didn't treat it long enough.
Plus, it depends on the life, the personal life, circumstances,
The
the environment,
I'm just
the
saying that
surrounding.
that's one of the problems. So.
Sure.
And it's something that we need to address is that these are chronic relapsing conditions, and so just to let them know that from the get-go is very important.
Absolutely. We're going to go to Hussein right now to the Facebook comments and questions.
Thank you, Khodr, for sending the
Finally,
live
right?
stream to me. Finally, I've been
Yeah,
shouting at Khodr.
Sorry about that, guys, by the way. Just took a second. Yeah.
I just want to mention some of the comments. Thank you to everyone that's watching on Facebook. We have a lot of comments that came in, so we just want to acknowledge some of these comments. Marwan Faraj is saying, great show. Hassan Mistrah is saying, I'm glad you guys are given more time to talk about these topics. Samia is asking, how do you know someone is experiencing a mental health issue or addiction? So if you guys want to answer this in a bit. And then Haji Batul Abbas is saying, great information to know. If we can focus more to the discussion about depression, anxiety, and then if we can also talk about marijuana, because many people say that marijuana is fun, it's recreational, you can have it, there is no health issues, there is nothing that's going to affect you. So I want to really focus for the next part about, if we can start with answering the question from Samia, how can you discover if someone has a mental health issue or addiction, and then move to talk about a bit about depression, anxiety if possible, and then about marijuana.
Sure.
So I'm going to send it back to you, Khodr, and then every 10 minutes send it back to me, please.
You got it. I'll do that for sure. Thanks so much, and thank you guys for asking this question, making these comments. Yeah, because doctors, mental health and addiction both are invisible. People can't see that unless there are some super clear symptoms, which we touched on that briefly a minute ago. If you guys can, elaborate more on that from addiction side and the mental health side.
So sure, I'll just touch on addiction, and Dr. Shebak can talk on mental health. So addiction, if you suffer from a use disorder, whether it's alcohol, opioids, or any other type of drug, there are symptoms or criteria that patients suffer from that will give them that diagnosis. Some of them are using larger quantities of a drug or substance than intended, or missing important events, or getting into trouble with the law, or trying to quit and unable to. These are some examples that somebody might suffer from and really have an addiction. So we usually will ask questions, for example, you drink alcohol. Do you ever try to cut down on your drinking? And if a patient says, yeah, but I'm not able to, they'll get a point in terms of having an addiction to alcohol. Or do you ever feel guilty the next day for the amount of drinking you drank the night before? If somebody said, yeah, they would get a point. And there's, criteria for, different substances that people can be addicted to that will give them that diagnosis of having a use disorder.
Sure. Just a follow-up question, Dr. Saad, if you don't mind. So let's say if someone comes home and the parents are not fully aware of the symptoms, and then as a kid or individual, whatever, they try to hide that they are addicted or they are abusing or using these substances. How can you as a parent or sister, friend, neighbor, uncle, cousin find out or possibly doubt it?
Start, having open conversations. Sit down with your child, talk to them, look at their friends, see if any of the friends are getting in trouble in school, if your own child's getting in trouble in school, see where they're spending, their free time. Start laying down some rules and seeing, having discussions with your child, and even take them to see a doctor. Take them to their primary care doctor. Have the discussion with the primary care doctor. Say, I think something's wrong with my child. He's acting funny. He's taking a lot of money, and we don't know where it's going. I found this substance in their pocket. Can you tell me what it is? Be open with the primary care doctor. Reach out to the teacher. See how he is in class. And open up with your own child and try to create an avenue, a non-judgmental avenue, and one that you care and you want to help out. That's what I would do if I was a parent, and that's what I instruct the parents in my clinic to do.
Khodr, if may, there's a follow-up question, if
Sure.
you don't mind. I think one of our guests mentioned about until medication start working. Huda is asking, what do you mean in the meantime until medication start working?
Who's that?
Take into effect.
Did I say that?
I'm not sure who said that.
I think Dr. Shebak, when you were talking about the symptoms,
that's fine. I mean,
when they went down, he said after taking the medication.
And then, if
okay.
I can
Yeah.
just ask the other question
That's
too.
fine. I'll answer those.
Wael is asking, I have a question. If a person is having a treatment for depression and it's not working for him, what should they do? And we have another question. I have my friend, he's depressed and he tried so many medication and nothing has helped him. How can we help?
So, when we start a medication, sometimes for some disorders it works really quickly. So bipolar is notorious for kind of clearing up pretty rapidly when you start a mood stabilizer, lithium or Abilify or something like that. Other things like the antidepressants work a little slower. So it takes a week or two, sometimes 3-4 weeks for the antidepressants to kick in. So in that meantime, I usually schedule very close follow-ups, once a week, once every 2 weeks, to make sure that the patient is doing okay and that they're tolerating the medications. And sometimes in the beginning, we also do a lot of trial and error and change meds a lot if something's not working well. And you combine things and work on different receptors. But when I say in the meantime, as the medication takes effect, if they're not enrolled in therapy, then I just see them more frequently in shorter appointments to make sure that they're doing okay. And when they come back for follow-ups, we usually do a screening for anxiety and depression at every follow-up, so we monitor the numbers as they go down. The other thing is, the first line of defense for mental health and mental disorders is your family and friends. Depending on your age, one is going to be more important than the other. The second line of defense is in a faith-based community is going to be religious clerics and things like that at the mosque. And the third line of defense is your primary care physician. Before you go to a psychiatrist, you go to your primary care physician. Most of my patients come from either referrals or they've already been treated by the primary care. So those are like the lines of defense. Then you get to the psychiatrist. Now when you start failing medications once, twice, 3 times, then it's probably a good idea to find a psychiatrist or talk to your doctor about sending you to a psychiatrist, because there's combinations that we can use. There's other treatments that we can use, different cranial stimulations and magnets, and there's different modalities that we can use.
Dr. Shady, if you don't mind, you mentioned medication so many times. So they're asking basically if we are trying to get people off medication don't you think that they will be addicted to those medication? And the ones that you prescribe, are they addictive or not?
So no, the goal is not to get people off medications necessarily. If someone has some severe depression and it's relapsed 3-4 times, the goal is to make sure that they're not going to kill themselves.
So it varies on the
up.
case.
Yeah, straight. I mean, I just want to be pretty straight
So
on
it's a
that.
case-to-case basis.
Case-to-case basis. Now, there's medications that are addicting and medications that are not. Now, generally, the medications all will have some type of withdrawal, mild withdrawal, but they're not necessarily addicting. You got certain medications that are used, like benzodiazepines, which is like your Xanax, Valium, Librium. Those are going to cause, those can cause addiction, shouldn't be used long-term. And that's one thing I did want to address. I didn't know what was going to happen now, but you know, if you're on one of those medications, talk to your doctor about seeing what other options exist, because those are not long-term medications, and long-term they can actually make anxiety worse. So you have to go to someone who knows what they're doing, right? At the end of the day, that he's not going to get you hooked on things that are addicting. Sometimes we may have to use certain medications like benzos for a short period of time, but in general, medications that are used like SSRIs that are used for depression, or lithium or Abilify, these are not addicting medications. These are not, opiates. These are not something that's going to cause physical dependence going forward and things like that. So the goal is to make sure that you clear up the patient and you provide them with medication and therapies that work long term. It's not necessarily to get everybody off medications, but when we can, we do get people off medications.
Very good. Dr. Saad, can we ask you the same question, since you deal with a lot of addiction?
Sure, absolutely.
So you're trying actually to get them off of pills like Vicodin. Can we name some of those pills that are addictive? We know Vicodin, we know...
Yeah, you have your, Norco, oxycodone, morphine. So I'll just talk about the opioids, Dr. Shady.
Please, if you don't mind.
About the benzos. The interesting thing is with treatment for opioid addiction, we actually use another medication which is addictive to get people off of opioids.
Oh.
And that's, you hear it on the, people might mention it like Suboxone or Zubsolv. And some might say, oh, why are you using an addictive medication to take people off of Norcos or Oxys? So when these medications are used correctly, there's a couple positive things about them that help people control their addiction. So one thing is, there's a ceiling effect. So if you take Norco, you will continue to crave it and continue to take more and continue to try to get your euphoria or your high. If you were placed on a medication to get off of Norco like Suboxone, there's naloxone in it. You might hear of naloxone or Narcan. It's in that medication, so it prevents somebody from getting the same high that you would get with Norco. So it's a partial opioid agonist. It's still very addictive, but this will allow a patient not have to take 10, 20 tablets of Norco a day, and they can get by with only taking 1 pill a day of the other medication. So if you ask, a patient who's receiving Suboxone, oh, you're addicted to that, they'll tell you, yeah, but I go to work, I have my life back, I don't go through withdrawals, I'm not buying 20 tablets a day just to get by, and my risk of overdose decreases.
Can I ask you? So I want to engage our panel and our listener who are listening online. How sometimes you go to the multiple doctors and they give you multiple medications, and without you knowing, you are overdosing basically because of some medication working together. You are automatically overdosing. That's one part of the question. How would you know that you're not overdosing because of using multiple medication at the same time?
Well, it starts with the prescriber or the doctor before the patient. In our clinic, every patient that we see, we do a MAPS report, or a report that looks for all the controlled substances that a patient is on, whether it's Norco or Oxy or morphine. And that way we get an idea of where the patient is. Along with the MAPS report, we take a patient's medication log. So we try to see what meds they're taking. If they don't have it, we'll call the pharmacy. And then it's on the prescriber to start identifying medications that have drug-to-drug interactions. So that's where it initially starts, and then it goes down to the pharmacist who's dispensing the medication. If they're dispensing multiple medications that can cause overdose, the pharmacist has a responsibility as well to either call that doctor or not dispense the medications, or even, if it happens repeatedly with a certain doctor, to even let, the state licensing know, hey, something's going on with this doctor. We're getting a lot of medications that are addictive and can cause overdose. And then the third person I would put to prevent that from happening is the patient himself. You know, before you take a pill, know what it is, know what it could do, know your side effects, know if it's addictive. So that's how you would prevent somebody taking, you know, multiple medications from different prescribers that can cause overdose or addiction.
As a follow-up, you know, sometimes some of the medication, that it gets prescribed is actually as addictive. When should a patient stop those taken medications and know that, you know what, probably I'm getting addicted to it? Mm-hmm. How would you know I'm starting to get addicted to some of these medications? Whether you're taking them for mental health issues or whether you're taking them for addictions?
So most of the meds I prescribe for mental health issues are not addictive. So let me just put that out there. And when you are on something that is addictive, addictions, so I'm going to let him speak about this, but addiction starts out as very impulsive. You get excited about taking something, and then somewhere along the line it turns into an anxiety issue where you're anxious until you take a medication. That's kind of, I think, one of the rough lines you could draw. But I'm going to let Dr. Saad discuss that further. But it's important that once that does happen, or once you see that you are on something that's being used long term that shouldn't be, then to try to talk to your doctor or try to find somebody new to talk to about it. Again, some of these medications are good short term. So if I have someone with extreme panic and nothing's working, so I give them Klonopin or Xanax or something just for maybe a week or two until the real medication that I prescribed starts to kick in and work. That's the healthy way of using these medications, but having someone on it for years and years and years, that's not good.
So I'll talk specifically about opioids in terms of their addictive properties. So recently, you know, this past January, the CDC did release some recommendations. So if you had an injury, you went to an ER and they were going to prescribe an opioid to you. Previously, they used to give you, they could give you a month's supply and tell you to follow up with your primary care doctor. And that month, the studies show that you could get addicted to that drug even in 30 days, even if you've never used it before. So now the CDC guidelines are you cannot prescribe an opioid to a first-time patient for more than 3 to 7 days. So the doctor has a discretion. It's recommended not to go over 3 to 7 days. And if he's going to continue that medication, he has to see them within 7 days to write a second prescription. So that at least that barrier is there to prevent patients from, without knowing, get addicted to these opioids. In terms of what Dr. Shebak was saying about patients initially when they're getting addicted, getting a high, that's absolutely correct. So patients will start on the opioid. They'll get that good feeling. They'll get that euphoria. They might get a little bit of energy, be able to do more activities, and feel overall good because that's how the drug is designed. But once your body becomes dependent on those opioids, all of a sudden we have a transformation in our brain, and we get an increase in a part of the brain that is where our sympathetic nervous system is, basically where our anxiety, our stresses, that part of the brain is overstimulated and you get withdrawal symptoms without realizing it. So all of a sudden people are taking more pills to just preventing a withdrawal. And it's no longer about getting a high or feeling good, it's just not feeling bad. That way they're able to take care of their kids or go to work. And that's the majority of the patients that we treat for addiction is they come in and say, I just don't want to go through a withdrawal. I just don't want to feel terrible. It's not about, I want to keep feeling good. I want to keep feeling that high that, I crave. I just don't want to feel bad. I want to be able to go to work. I want to be able to take care of my kids.
Dr. Shady, since we have a lot of students and young age that watch, a lot of time they say, it's fine, let me take Adderall, or let me use some marijuana so I can focus, and it's not addictive, and I can get off of it anytime I want. What would you say for them?
So with Adderall, let me say it like this. So I don't have ADHD. If I were to take Adderall, I would feel great.
Okay.
Right? So I have patients that come to me and they tell me, when I take Adderall, I feel wonderful. I feel good. It helps me. Well, yeah, it's a stimulant, right? If I took it, I'm going to feel great and wonderful and happy, and I'm going to be able to do things, or I might get anxiety. Depends on my genetics, but over time, if you do not need this medication, you're just getting yourself addicted to something that's basically a milder form of like cocaine.
So Adderall is addictive?
It is addictive. It's a stimulant. It's not like addictive like an opiate is addictive, but it is. You do get dependent on it. And some of the people that do, they start taking a lot of it at a time. So they'll take 5-6 tablets at a time, and then they're putting themselves at risk for heart attack and sudden death and things like that.
Since you mentioned anxiety, Huda is asking you, when do you know when the anxiety is so severe that it causes fear of everything? The only relief so far is Ativan. Ativan.
Oh, Ativan, yeah. So anxiety
Excuse
can,
my
no, it's
knowledge
okay.
of
No,
the
I
medical
understood
term.
what you said. I'm trying to understand the question. Sorry.
No, you're good.
So maybe she's asking when her anxiety is so bad, a doctor should prescribe a benzo.
Yes.
So when anxiety gets, so when I see a patient that's suffering from panic attacks and they can't leave the house, or every time they get in the car, their heart goes 100 miles per hour, and they're constantly in that state, I don't want them to suffer with that. So I will give a benzo, usually not Xanax, but one of the other benzos, and just for a few weeks as we figure out what long-term medication is going to work for this person, right? So that's an appropriate way of using it.
And as a primary care physician, if somebody had such severe anxiety that they're not able, to go to school or to do normal tasks, what my job would be to, I would start an SSRI, which is non-addictive, and refer her to a psychiatrist, because the psychiatrist would be able to provide the complete mental health that she would need.
Very good. Khodr, sorry I took a lot of your
Oh,
time.
no
We're
problem.
co-hosting the
No,
show,
that's very
but I just
important
wanted to make
because,
sure we include our viewers on
Exactly.
Facebook, because they had a lot of amazing questions, and the questions are
Absolutely.
still coming. Sam Abdullah is asking, with all due respect, what is the solution to this issue without harming anyone? Can we go back to the old days? Would that do anything? I don't know what the old days, so we asked.
Meaning no medication?
No. I think he's talking about old values and old world values. Again, there's no way to do that when we came to a new host country. Not we, I was born here, but like my family and things. So we have to just acculturate and integrate and help one another integrate in a way that's healthy without us forgetting our values, but at the same time adopting new values that will help us deal with this issue.
Okay, can
There's
we
just
include-
no way to go back to the village. It's not going to happen.
Very
but
good.
Sometimes maybe we wish we could go to simpler times.
Our panel. It's been a while since we didn't hear from you. I know Muhammad Bakr, you had a question about community-based organization. Let me read your question. Do you want to ask it or you want me to read it? You want? Okay. So, there's a question: what role do mosques and churches have with these problems in our faith-based community?
Shady said a great point, that definitely the mosques and churches play an important role, especially in the younger child's life when they're growing up, and if their parents attend them and attend these places and take their children there, they're more open about the subjects, and they're able to talk to us. And I still remember when we were in elementary school, there was the DARE program, Dare to Stay Away from Drugs, that definitely has a lasting effect. So the mosques, when it's the Eid, and kids are there, and if they're having a program for the children, it's okay to be open about it. Hey, stay away from these drugs, stay away from pills. Talk about what friends to avoid, and just give resources for parents and families. So I definitely think they play a huge role.
I think they play a role also socially, just socializing your children in these places. If they're, if you're prone to be a religious family, then it could be a protective factor. We know for suicide, for example, there's certain religions that are actually protective because of they say that it's wrong to do the suicide, so it's actually protective. It actually protects people against suicide. That does not mean, so let me say, that does not mean they protect against depression and anxiety and the symptoms or suicidal ideas, but they protect against the actual act of suicide, more so than some other traditions that may not have a religion behind them. But that does not mean that they protect against depression and anxiety. Yeah.
What role can those community scholars and religious leaders play? I mean, they have a huge following and they listen to them. And why or what role can they play? Because I don't see a mosque that basically, or a church that basically speaking about it. What could be the cause? I mean, is it because of the shame and pride that we are talking about?
They may speak about it, but they speak.
It's very few. I
It's,
mean, let's be honest.
it's not that effective if
Unless something
yeah.
happens,
Yeah. But it's
bring
not.
it up.
Yeah, I think they just create a welcoming environment, honestly, and I could get into that a little bit more maybe next time.
Well, if they don't touch on it a lot, you have to keep, for these young people, you have to touch on it constantly, and they learn. So it's not going to come from a place that you go to for an hour a week or however often, but being around your family and your parents, they're going to talk to you 3 hours a day or 10 hours a day. You're interacting, creating and delivering the same values that you have as a parent. And you're reminding them, constantly reminding them to do the right thing and not ignoring them, saying, oh, the school will take care of it for me. I'm just going to go to work and provide for the family. You have to constantly remind them, these are important. And when you are with your child and you're around somebody who's struggling, you can say, that person's having a challenge and this is why.
Right.
And I'm explaining it to you now because I don't want you to have this challenge.
So
And when you put it that way, they can say, I can see that if I don't do what Dad says, I could end up having this problem that becomes very scary. And you essentially scare them out of doing drugs in a roundabout way.
So in
just coaching them.
in medical
ahead,
school,
Shady,
we used to learn, you learn a disorder and you learn it with a case, right? So you learn schizophrenia, you see a schizophrenic case, you learn it, you get it. Maybe what parents can do is teach the lesson and couple it with a value, with a tradition, with something that this is important value, here's the lesson and here's why it's important. So couple it together. What we don't want to see is, I don't think we want to see the mosques become sterile hospitals. So we don't want to also like flood the mosque with these topics every single week, every single day, because a mosque just being welcoming and being a center for the community can be very helpful in and of that self. You don't want to just have every segment of our lives just be very sterile and about addiction and mental health either. So I like
And
what
the
you were
10
saying
other
about
topics
parents.
we have.
Yeah, exactly.
There's lots of topics they could be
The very
a
helpful.
focal point of, and then all of a sudden it's a very negative experience when it's meant to be a relief to go
Right.
Yeah.
Then
and
just
feel better when you leave. You know, the
I know Becker, he asked in the beginning of the show about should parents, or families that are dealing with deaths due to overdose come publicly and speak about it. Back to that topic, how do families, how do you recommend to them to deal with someone, the aftermath of someone dying from overdose or deaths in general? Mentally, how do you deal with it? And then Dr. Saad too.
For me, I'm not an expert in grieving, but I would
Like
just,
responding to overdose deaths.
if it's an overdose, like they're going through a hard time, that's when a mosque is supposed to step up. Comfort the family, comfort the parents, provide reassurance, and the parents can find so many different ways to grieve. Some might go on the ziyarah, some might go back to Lebanon, some might start a new foundation or something and go around and talk about addiction around the city. But every parent is different.
Should they seek, a psychiatrist?
if they need to.
When do they know that they need to?
Yeah, if they start to, if it gets bad, where they're isolating, they're not leaving their house, they're becoming extremely sad, they're maybe seeing visions of their lost ones, right? Or they're not sleeping anymore, right? Those are signs, those are telltale signs, or they have suicidal thoughts themselves or something like that. Then they should probably see somebody, or they should see somebody. But if they're grieving normally, we don't want to medicalize normal behavior, right? So I don't encourage just medicalizing everything, right? But when it becomes a medical issue is when there's certain telltale signs.
Very good. Khodr, I'm going to send it back to you so we can start talking about marijuana for the next 10 minutes, if you don't mind. I know we went over time a bit, but if you guys don't mind, we can close with the marijuana.
Okay. Sure, not a problem. Hussein, thanks so much for following up. Before we can dive into that, anything else from the panel? No.
Just one question.
Please go ahead.
So, psych patients who come in and say there's something missing, what can we do as a community, as a parent, as a friend, to help kind of fill that gap for them?
Who's going to go first?
Sorry, that was a side question.
It's a hard question. I mean, what can a community do is maybe we can do it individually, is just reach out to people that we know may be struggling. I think it starts with the individual rather than the collective, but that's just maybe my philosophy on it, is that we can control ourselves individually, we can be good people individually, we can reach out to people. It doesn't always need to be the community is speaking, the community is doing, the community is going to go help this person. Just go do it. Just go help, go reach out. This panel's full of people that do that already, so.
So we're going to move on to the last segment of the show, unless you have anything to add, George or Dr. Saad.
No.
or no?
We're good.
Yeah, we're good.
All right. So we're going to talk about marijuana, which sounds like it is the most accessible. I'm not sure if that's still the case or no longer the case. We'll hear from you guys. Is it the most accessible, common? Some people say that it makes them remember everything pleasurable and forget about everything that is bad. That makes them feel great. It becomes a routine. They need it. So all of these that we always hear about, what's your take on that?
You know, I'll just give a little bit about marijuana without giving
Sure.
my opinion. You know, just what some of the studies have definitely shown.
Yeah, I mean, scientifically and from
Well,
what you see.
if you know, some people say marijuana is not addictive.
Or it's not bad.
Yeah. So if somebody smoked marijuana, you know, every day and then quit, they would go through a withdrawal. So for something to give you that severe of a withdrawal that can last, you know, we've had patients that go over a year with the withdrawal symptoms, especially the mental symptoms, the anxiety, the depression, that shows it's definitely, you know, causing addiction, dependence in the brain and changing the way our brain functions. So that's medically been proven. Along with, there's studies that show the earlier the person starts smoking marijuana, the higher chance that that person has a risk for an addiction to another drug.
So they start to climb
Yes,
up the ladder gradually.
Correct. So that's what the studies show. That if somebody started smoking marijuana at 15, they have an increased risk of, you know, becoming, you know, cocaine, heroin, Adderall, many other drugs that are at increased risk. So if they were going to start at 15 or they were going to start at 18, their risk decreases in terms of developing addictions to other drugs. So that just shows that marijuana affects a developing brain. And the third thing I was going to say is, and this is a mental health issue, that there's a definite increase in psychosis and an increased risk for schizophrenia with somebody who smokes marijuana. So that's just the third way that it's proving that marijuana affects our brain, causes addiction, dependence, and withdrawal.
He's absolutely right. So the brain is kind of developing throughout about 25 to 30. Your brain is still developing. It's still pruning, it's still cleaning up, it's still doing its thing. So young adulthood really probably goes up until about 30, late 20s, early 30s. If you're smoking marijuana, it does disrupt that attenuation process, the process in the brain, the pruning that's going on in the nerves and the neurons. So, and you do see an increased risk of psychosis in that age group. Not everybody will get psychosis, not everybody will get schizophrenia, but a lot of them will. And especially with the high concentration THC oils that people are smoking, the availability of it, people are smoking every day. This is becoming, I'm seeing more of it, a lot more of it, personally in the clinic. So it is not just, it's not benign, it's not just happy-go-lucky, you know. And in the short term, it might help some people with anxiety. Other people, actually, in the short term, it makes them paranoid and more anxious. Some people may feel a relief of anxiety. We call that being high, right? That's not something that can last forever. So you're masking something. So if you're masking something, let's get the help that you need.
Sure.
So you don't have to mask whatever it is you're masking. What's irresponsible is people that should probably know better, that are saying things about it being benign and things just because they use it or something like that.
Just because they desire it.
Just because they desire it, or
Doesn't mean that
political
it's, you know,
motives, or what have you. That's inappropriate, I think.
Sure.
And the love affair between certain people that use marijuana and the marijuana plant itself is something that should be studied, because people really form a strong emotional love to this
Attachment. Yeah, they become attached to it. Let me ask you also another question about marijuana. Having it being legalized medically in many states, including Michigan, and many countries around the world, where can we categorize something that this is for medical use and this is not for medical use?
So there's only 3 proven medical indications for marijuana. One of them is nausea, vomiting, due to medications like chemotherapy, HIV medications. One of them is failure to thrive. So if somebody's not eating, they'll give them a medication that has marijuana in it to open their appetite. And then the third one, it's not actually anxiety, which most people will say. Glaucoma could be treated with marijuana. So those are the three major medical indications that people have been smoking marijuana. In terms of psych, I don't know if there's any medical indications that.
Not from my knowledge, but what I do know is that people can get the card for just about everything. So I have patients like, I have migraines, so I use marijuana for that. I'm like, I've never heard of that before, right? So people are writing cards left and right. And even the addiction patients I have to be careful. I've found that I've had to be okay with people using it. Some people, like, I don't kick them out for using marijuana if they're on medication-assisted treatment because they're just not going to stop.
And the
It's so
state's
accessible.
allowing it.
Yeah, as part of our obligation to monitor patients administratively, we have to do a drug screen on everybody. So those go across my desk, and all those reports I see are
Marijuana.
THC.
all have THC in them in one form or another. And
THC.
THC, yeah. So the marijuana, and the metabolites are in the urine, and we see them all the time. We want to have a discussion with the patient about this. This isn't really good for you. Even just the process of smoking, taking smoke into your lungs is not good. And when those patients, come back and say, well, it's no big deal. Like you said, it's legal. What's a big deal? The quantity that they're smoking becomes more and more frequent. It's super potent compared to, like right now, the lawmakers are okay with changing the laws and allowing this stuff to happen. But they were my age, and at my age, when I was a kid, THC levels were 4 or 5 or 6%, and now they're 30% in this engineered, day and age. That power renders somebody almost unconscious. They are, extremely impaired, and those people think that it's just okay to go drive or interact, in their business life or their daily life when they're impaired, and they will ultimately end up suffering the same consequences of patients that are addicted to other drugs, which is, the dissolution of their productive life.
And adolescents, I can't stress enough, adolescents shouldn't be using any drug really, but marijuana has something that messes up with things and makes psychosis a lot more prevalent in that age group. So,
Can I, if we have a question from Hassan Mistrah on Facebook, he's asking what kind of marijuana is available in the market, and also, do you think personally that legalizing marijuana was a good or bad decision?
It's a bad decision. I don't even have to think about it for 2 seconds.
for me, it's a little bit more nuanced. I agree with you, George, to some extent, to a big extent. But I think that if they really wanted to push the legalization and it was like this thing that they just couldn't get away from, then maybe they could have done some deregulation or not deregulation, not legalization, what's the other word? Decriminalize it so that people are not going to jail for it and things like that, but not necessarily make it where everyone can grow it in their house and you can have markets down the street and I could go and buy it, right? That was it's like we went from illegal to legal in one big jump, right?
Yeah.
So that was weird, and
Yeah, the other, Dr. Hassan.
Yeah, no, definitely I don't think it should be legalized, especially as a board-certified addiction doctor. The amount of cases you see where somebody will say, this drug caused me to be here. There is some medical benefits, a few medical benefits. Those patients, there's already formulations that they can use. There's tablets of Marinol and other medications that they could take that have the product of marijuana. But to legalize it, as Dr. Shebak was saying, where people are growing plants, smoking it, finding any reason, I'm not for that.
Our panel, are you guys for or against legalizing marijuana?
Against.
Why?
I think because there's so many negative aspects to it, that if a person was really in the need of finding that euphoria that Dr. Saad was mentioning, or that high, then they should learn some type of self-awareness where they're like, okay, I understand I need something. What is the best and safest method to get that? Granted, adolescents who are in peer pressure, especially in social atmospheres, it's you either take it and you're cool or you don't. And it goes back to the whole smoking and drinking thing. But this has become such a normal thing that if you don't do it, then you're marginalized. But I think people need to understand long-term effects and understand at the present moment it's not going to help you for 2 minutes, but destroy a large part of your brain later on.
Very good, Becker.
So I'm not a professional from the medical sense. So my own personal experience, got through high school, college, and I've seen many of my friends' lives get messed up through drugs, whether it's marijuana or not. And I've seen others that went through that path and now they're parents and, you know, everything is normal. From the sense that I would touch upon was exactly what Shady was saying. Marijuana has been used to crack down on minority communities and lock up people and fill up our jails. We have the highest incarceration rates. So from that aspect, I would want that addressed. As far as legalization goes, I don't think it should be legalized, but I think their opinion matters more because they're the professionals. They're the ones that see that. They see what we don't see.
Very good.
You know?
Samir?
I have a question. What's the biggest difference between THC and CBD? CBD seems to be becoming more popular in the community. People are saying that it helps with anxiety and it helps them sleep. Is there a lot of research done on CBD that you're aware of?
I have no idea what that is. I know that's in marijuana, and I kind of am very skeptical of everything, so I think that it might just be a placebo, but I'll let you
It's
know.
meant to be a processed byproduct that doesn't have THC in it. So it's meant to have the supposed health benefits without the
And
euphoric.
they stimulating the same receptor in the brain, so you're getting a similar effect.
Okay.
Very good, very good. Khodr, I'm going to send it back to you so we can end the show. I want to apologize for our guest for going overtime. I know we said an hour, but the conversation went on and on. But Shady, you have something?
I just want to jump in because I think Bakr touched up on something very important, that we're all of our opinions will matter. Now, people from the community see things differently than maybe how I see them or how Dr. Saad see them. So never be ashamed to give an opinion, but as long as it's grounded in some form of fact or science,
Yes.
or at least you take into consideration what the professionals are saying.
Sure.
But don't be afraid to voice
Sure.
your views and feel like you're intimidated when you see a couple doctors
Sure.
and things like that. So.
Hussein, are there any more questions or comments over Facebook before we ask our guests in our panel for a last remark?
I wasn't going to ask it, but we have one more question.
Sure.
They're asking, can I use marijuana for epilepsy?
There is, it's not a common. It's a very rare form of a seizure disorder that marijuana is an indication. So there is one form.
Very good. That was the question.
Great,
Back to you,
thank you.
Khodr.
Thank you, Hussein. Our guests, I mean, in the midst of what we're going through, which of course, with all sensitivity, with the deep condolences and sincere condolences to all the families that have lost, loved ones to drugs. I mean, what would it be? Like, what is your wish today, both of you guys, as doctors, professionals, to make things, more positive?
My wish is if you see somebody who needs help, there's a lot of places they can get help.
If you can just also, please, sorry to interrupt you, if you can also mention how people can get in touch with you.
Yeah, so if you have a loved one, a family member, you think they're suffering, I'm going to talk just about the addiction. I'll let Dr. Shebak talk about mental health. If you think they're suffering from an addiction, there's so many resources now available. I think our community is doing a great job. There's a lot of different organizations that have come up. They're all over Facebook. They're having, monthly meetings. You can get help, reach out to somebody, come into my office. Even if you're coming in for primary care, you could come in, you could bring up, your family member that you think has a problem. If I can't help them, if they don't want to come to my office, we'll refer them to the right people. But there's definitely a lot of resources. There's a lot of treatment options. Nobody should go living with the addiction and not get the help that's there.
Well, where's your office located, if you don't mind?
So
sharing that, please?
right down the street. We have two offices. So the one in Dearborn is on 6500 Schaefer. It's right across from the fire station. Our office number is 313-584-7900. And we just started a second practice in Sterling Heights.
Congratulations.
Thank you. 14 Mile and Shaner.
Awesome.
Just to mention, we're going to put those contact info on the thread for comments on Facebook, so people can see those on the caption for the episode, and they're going to see it on the thread for the questions. So we're going to put the contact info for Dr. Saad and for Dr. Shebak. This is a question. You guys probably will talk about it next time when we do a follow-up for this episode, but Wael is asking us to talk about chemical imbalance in the brain in general. So we promise you, Wael, hopefully we can do another episode and talk about that stuff.
That is an entire episode, I think.
It is.
Well,
Okay.
that's all hypothesis, but yeah, we should talk about that.
Sure. He's asking chemical imbalance and serotonin.
Yeah.
Okay. George, final words from you?
Final word regarding for the folks out there?
Much, like everything, like, what is it to the community, to our families, to your patients?
Look in the mirror, and if you feel like
What about
you're not doing, be introspective.
Listen to yourself.
Be introspective with love, and the folks that are around you, if they're having trouble, support them like you would want to be supported if you were having trouble.
Great. Awesome. Thank you. Let's try
For-
to mess you up, but
I think that we just need to, my wish is that we would all just be kinder, nicer, help each other out. Don't give up on your traditional, on family values and things like that just because certain narratives are very loud in the media. Be confident in who you are and help each other out.
awesome. Our panel. Any final remarks, opinion, comments?
I hope the community takes your resources into consideration.
Absolutely. Absolutely. Any other comments or questions from the panel, our guests, before I give the closing remark? I'm sorry?
Should I give the clinic information?
Yeah, please, go ahead. Although Hussein's going to add it to
okay.
Yeah, but go ahead, please. Please go ahead.
So Core Psych PLLC is located at 3815 Pelham Street, suite number 13.
Dearborn,
And,
right?
it's in Dearborn, and the phone number is 313-429-0470. If you guys think someone needs any mental health help or needs some outpatient care, please don't hesitate to call us. And you're going to be seeing more of me and Dr. Saad in the future, inshallah. We're going to be doing a few more talks and working together and integrating
Sure.
our practices.
Sure. Well, I would like to thank you guys for your time and for this quality information. Thanks to our panel as well. And thanks, as always, to WhatsApp Media Network for opening up the air for us to talk about such an important topic. Ladies and gentlemen, we really witnessed such quality information from really quality doctors who really care from all what they got. So please do not really hesitate to reach out and to ask for help. Or if you know somebody who's needing help, please make sure that you encourage them to go also and seek help. Thanks once again to all the followers and listeners online. Thanks to all the sponsors of WhatsApp Media Network. Hussein, thanks so much, and thank you for putting up with me, guys. Appreciate you guys. Wish you all nothing but the best, and hopefully you guys will see you soon, and I'll see you soon on Tuesday at my show, A Spot of Hope. Good night.
أول ما بتلتقوا بحدا بتسألوه شو الأخبار، لهيك لنكون قراب منكن ونحكي لغتكن سمينا حالنا شو الأخبار. بلشنا بخطوة وماشيين بآلاف الأميال، خلينا شغفنا الخبر والعين اللي بنشوف فيها هالدنيا عدسة كاميرتنا. قررنا نكون منكن وإلكن، تشاركنا فرحكن وحزنكن، تشاركنا مشاكلكن ووجعكن، وكنا ورح نضل منبر لجاليتنا. شو الأخبار ويب تي في باقة كبيرة ومتنوعة، برامج حوارية، تقارير إخبارية، برامج ترفيه، برامج ثقافية بالإضافة إلى إعلاناتكن. شو الأخبار؟ الخبر اليقين. تابعونا الآن.